I am Shalin Kocher with Strive Pharmacy. Really excited to be here to talk about Sermorelin with weight loss. Um, when I talk to just regular patients out there, regular people, I think Sermorelin is sort of like underappreciated. A lot of our providers are sort of familiar with it, but when you ask around, yeah, they've heard about semaglutide. When you talk about Sermorelin, they're not very familiar with it. But it's one of these medications that just works beautifully with GLP-1 agonists and weight loss programs. And yeah, very excited to discuss everything about it. At the end, I hope you have a better understanding of the sort of the niche that it occupies in a patient's management, some of the pharmacokinetics, some of the um, pharmacological actions that it has, and just how well it integrates with GLP-1 agonists. So what is Sermorelin? It's a synthetic hormone peptide composed of 29 amino acids. It is very similar to something that is naturally produced by your body, which is the growth hormone, the GHRH, which is a growth hormone releasing hormone. Sorry, I momentarily skipped on that. And what it does, it stimulates the pituitary gland to release growth hormone by itself. This is important. It does it in a very sort of an adequate amount with the correct timing. And this gives it a huge advantage over other sort of growth hormone modalities. It was approved in 1997 for the treatment of children with growth hormone deficiency. At that time, it wasn't a very successful medication because perhaps the push that it gave wasn't enough. You needed sort of more of a growth hormone surge in these kids, but just those very drawbacks that made it not so successful in the marketplace as medication for growth hormone in kids just makes it absolutely perfect for use in anti-aging regimens. To understand how Sermorelin is going to integrate with weight loss therapies, it's important to understand what are some of the drawbacks, some of the challenges that come with GLP-1 agonist therapy. A lot of you know this is a real thing, that when people start using semaglutide or tirzepatide, they will report a lot of fatigue with the medication, tiredness, and this is just bound to happen. The body is an extremely sort of resilient. It wants to keep everything in an energy homeostasis. And if you exercise a lot, if there's a lot of activity, if you decrease your diet, the body just will use various mechanisms from ATP synthesis regulation, enzymatic activities, hormonal feedback loops, muscle activity, to sort of try and keep you in a sort of a homeostasis. You don't even realize it. You'll start moving less. You'll start fidgeting less. There was a study done amongst the Hadza people in Tanzania, which is a hunter-gatherer group, and they walk about 15 miles a day. And if you look at what their daily energy expenditure is, it really isn't so different from people in Western countries. And it just shows to show how acute the body is in sort of regulating this homeostasis. And that is why when a person is going to be eating less for any reason, be it dieting or be it GLP-1s, the body is going to try and sort of fight that off. And that sort of fatigue can sometimes be exacerbated through nutrient depletions. B vitamins are extremely critical. B12 is a common sort of like a deficiency we would see in these patients. B12 itself is used in epigenetic regulation. It is used in a lot of metabolic processes. And when that is depleted, you can exacerbate your fatigue. Things to rule out would be patients would have electrolyte imbalances, and that can lead to fatigue. But a big one is just that the body is just going to try and burn fewer calories, and that just leads to that sort of fatigue. Another big sort of depletion just comes from protein, and that's a big one. It has a cascading effect. When you don't have enough protein, you're not going to get sufficient amount of muscle synthesis. And muscle is just so critical to our well-being. It is just needed for healthy aging. And it has a very high correlation to morbidity and mortality. Probably a reserve of muscle mass is probably even more important than having like less fat mass. Like it is so important that morbidity and mortality is more highly correlated with a healthy muscle mass than just a fat mass. So, the goal should be to improve your body composition. It is to preserve that muscle mass as best as you can. It just happens to be a sink for your glucose, your calories. And patients who are at an excessive risk, I think, of a muscle mass loss would be, you can have patients who are like super responders to GLP-1s. They will perhaps lose muscle mass too fast. If that happens, then the fatigue is more of a concern. Muscle mass loss is sort of more accentuated. And there are some patients who will come to you, they are not particularly obese. They just want a nice beach bod. And they would then be even at a more, if you're going to have a patient, say, losing 15% of their weight, and they don't have a lot of fat reserves to begin with, that loss is going to come from somewhere else, and it tends to be from muscle. So,
and to clarify, Shailin, I mean, when you're looking at this, GLP-1s don't technically deteriorate, because we hear so much in the news too, and we've talked about this a few times. GLP-1s don't deteriorate muscle. It's usually the nutrient deficiencies, again, that are pulling from those muscle reserves. Like you say in here, you're looking at how the protein in the muscle tissue kind of it's a sink for holding on glucose and holding that in there. But so a lot of times it's the malnutrition that people are having if they're not monitoring how they're eating well. And some of this, the simple thing to do would be, I'm assuming, just increase their protein intake if they are on a GLP-1, correct?
You're absolutely correct. It's a misconception that a GLP-1 will have a direct effect on muscle mass. It all has to do with, it's primarily tied to how much muscle is coming in. And there's a lot of things that are involved, growth hormone being one of them. And generally, as we age, we do tend to see a loss of muscle mass. And this, it tends to be up to 8% per decade every year. After the age of 60 or 70, that muscle mass loss can accelerate. If you don't have enough protein intake, if other factors are out of whack, I mean, obviously, it could be more severe. And after age 70 is when it really becomes, it can lead to other conditions. The body will first lose muscle mass that is probably not of a good quality. It's streaked with fat. The muscle fibers are of an irregular shape, and maybe that's not a bad thing. But when it gets excessive, it's a big problem. Further down the line, you're going to have patients complaining of plateauing out on GLP-1s, and that's because your muscle mass is a sink for calories, and that's bound to happen. And down the line, it leads to a lot of weakness. It leads to sarcopenia, which is this loss of muscle that you see in elderly people, and that has a cascading effect. You have sarcopenia that leads to osteopenia. Osteopenia then sets the stage for osteoporosis. Sometimes a hip fracture follows, there's frailty, and it's downhill from there. So it is just absolutely critical that you conserve your muscle mass just for your long-term health, but also just to keep your metabolism going.
Absolutely.
I would not probably attribute this loss of muscle mass through aging, directly just to aging. There are some studies done by anthropologists amongst hunter-gatherers, mentioned the Hadza in Tanzania. There's the San people in Southern Africa. And when you measure their measures such as grip strength, their muscle mass, it tends to be much sort of a milder roll-off with age. They tend to keep much of their strength, much of their muscle into old age. So it's not something that is bound to happen. I think so if you pair aging with a lack of muscle stimulation and a lack of activity is when the problem really sets in.
Mhm.
So that just gives us some ideas on how to remedy this. It's not a lost cause. I mean, it can obviously be fixed. Um, so protein intake, for the longest time, the government told us that it's going to be about 0.8 grams per kilogram. This was based on some nitrogen studies that were done. And the consensus among protein experts nowadays is that it's just insufficient. If you are going to give patients an inadequate amount of protein, the body will sort of adjust and reach an equilibrium. And recommendations now are probably optimally, it should be double that, maybe 1.6 grams per kilograms. At the very least, it is harder to sort of like even put on muscle when you're in a state of caloric deficiency. When you're in a sort of a starvation state, when you don't have a slight surplus of calories. And it then becomes even more important to have sufficient amount of quality protein. I think so just for body composition benefits, there have been some estimates that it can be as high as 3 grams per kilogram. For the average person, male or female, that would come to between 120 grams to 130 grams of protein. And it can be very challenging to get that. If you just look at one egg has about, I think so, 6 grams. So you want to hit those targets. It's going to be, it does take some effort. It does take some permanent changes to your habits and your eating style to get a sufficient amount of protein.
Which is
And,
where a good like protein supplement that Strive, I mean, the protein supplement that Strive presented last week was, I mean, spot on, clean, pure. And again, that's where you can kind of supplement some of this. We obviously try to always get things in whole foods, raw, not always raw form. Sorry, scratch that. I don't want to disclaimer, but healthy forms again, yes, whether it's chicken breast, salmon. I mean, you're going to get more from that, but
yeah,
supplementation is typically where that comes in to be able to fill the gap.
yeah. So you're absolutely correct, Dr. Adam, that as much as you can, you should get it from whole foods, because that also brings in a range of other nutrients that the body needs, and it uses, it comports, it uses them in conjunction with each other. So it's best to get a whole diet. But GLP-1 patients they have a reduced appetite as it is. So it might be a very good idea to supplement with a quality protein. Protein quality is just as important as the protein quantity. When we age, we actually become less responsive to packing on muscle in response to protein intake. The most important amino acid is going to be isoleucine is one of them, valine is one of them, but the biggest one is leucine, because not only is it a building block, it acts as a signaling molecule. It tells the muscle, okay, it's time to grow. And as you age, the response of the body to the presence of leucine just tends to wane. And it seems to have been evolutionarily preserved. If you just had sort of like unrestrained muscle growth in an ancient human, they would have hit the end of the evolutionary tree. So it's something expensive. What the body is doing is it feels that there's enough protein coming in. It feels we are in good times. It's okay to start synthesizing muscle. Otherwise, it is just like marshaling those amino acids that are trickling in just for purposes of building enzymes and hormones and so forth. And so this is why like supplementation might be a very good idea, especially in like elderly people. As it is, their hunger and thirst instincts tend to decline with age. They respond less favorably to protein intake for muscle synthesis. They have lower levels of growth hormone and so forth. Um, so to move on, if you understand how important protein is, how important muscle mass is to healthy aging, try and think of what's the ideal drug that you would want with a GLP-1. And each and every pharmaceutical company is on this problem. That is a picture of a Belgian blue cow. It's a freak of nature. It's just all muscle. It was bred to be that way. And scientists have been trying to figure out like what makes it like that. And the molecule of interest to them, the peptide of interest is myostatin. So there are lots of drugs in development. I can't even pronounce half these names there, but companies like Eli Lilly are paying billions for these medications that target myostatin or myostatin precursors. If you were to pair these with GLP-1s, you're going to have that ideal situation where you have muscle growth, packing on muscle, losing fat mass, and the two will go hand in hand. One thing is that if a patient goes on a GLP-1, they lose weight and they lose too much muscle. If they were to ever regain that weight back, it doesn't come back as muscle. It's going to come back as fat. So the idea should be don't lose the muscle in the first place. It really is very important. So we should be doing whatever we can, whether it takes protein intake, whether it takes the assistance of drugs like Sermorelin, or whatever it takes. Don't lose that muscle mass in the first place. So to give some idea about Sermorelin and how we differentiate it from just exogenous growth hormone is we have providers and patients who get a little leery when they hear the word growth hormone. Given by itself, growth hormone does have some downsides. High levels are, they're not part of the normal physiology. They will end up messing up a lot of feedback loops that your body relies on to function properly. It can lead to metabolic syndrome, high blood sugar levels, diabetes, sleep apnea, cardiovascular disease. And we've seen this even in patients who have acromegaly, who naturally have a condition where they have high levels of growth hormone. It comes with a shorter lifespan. If you were to give exogenous growth hormone, eventually it's not part of the natural system. You get tachyphylaxis where it doesn't work as well. The body doesn't respond to it. It can also sort of like wake up latent cancer cells. It can be sort of cancer-inducing or cancer-promoting. And for that reason, federal guidelines tend to be very strict on the use of just growth hormone itself. I think so there are just a few indications where it's allowed to be used. I think so in cases like AIDS patients who just have a lot of muscle wasting and a few other indications. But it does have its dangers. And the contrast with Sermorelin is Sermorelin has none of these drawbacks. Even compared with other growth hormone sort of secretagogues, Sermorelin does have numerous advantages, both over growth hormone and its other sort of competitors. So it's not a growth hormone itself. It's a growth hormone releasing hormone peptide. It makes your body make its own growth hormone. And it does this in a very beautiful and elegant manner. The amount produced by Sermorelin just tends to be very close to normal physiologic levels. A very important thing about growth hormone is that some of its best benefits come when it's integrated into a circadian rhythm. So the timing is critical. And because Sermorelin is not a growth hormone itself, it just tells your pituitary gland and the hypothalamic pituitary system to make that growth hormone at the correct time in the correct amount. It tends to be just enough to compensate for growth hormone decline that comes with age. It can be up to 15% per decade. I don't know how many people are aware, but that is substantial. When I was researching this, I was amazed at what a decline that is. And we'll discuss later, like some of the impacts this has with sort of diseases of the brain, Alzheimer's, sleep. It's all correlated, and growth hormone just has a very beneficial preserving effect on a lot of these body systems. So it is released often, I said, with pitch perfect timing. When you go to sleep, maybe an hour later, is you're going to start hitting deep sleep. And with that, within minutes of the first stage of slow wave sleep is when you get the biggest surge of growth hormone from your body. It tends to be more sort of pronounced in males for some reason. Estrogen has an effect where the growth hormone is released in multiple pulses, but in both males and females, that will be the critical time. This also comes back to like sleep hygiene. If you were to skip, if you were to skip your sleep, if you were to skip your routine bedtime, regular bedtime, you are likely just going to miss that growth hormone surge that you get. For most people, that happens close to midnight. And that's why they do advise, like, whether it's weekends or whether it's weekdays, keeping a regular bedtime routine is just very important. And so that's going to play into how Sermorelin works. Good sleep hygiene is just going to go well with how beneficial Sermorelin is going to be for you, because it's just inducing the body just to produce at the right time and in the correct amounts. Another benefit of Sermorelin would be it is produced in an episodic manner, which means it's these nice, fine sinusoidal curves. If you were to inject growth hormone as a bolus, SQ, it is impossible for the body to sort of regulate when that's going to be released. It's just going to be a surge of it over a period of time. It's going to be excessive. It's the timing is incorrect. The quantity is incorrect. And with Sermorelin, it's going to be just that beautiful curve. It's you're not going to get what's called a square wave, where you just have a huge bolus being presented to the body. The body doesn't respond as well to that sort of like growth hormone stimulus as it does to when it's naturally produced by the body at the right time.
And Shalan, would you say like that kind of that square wave, is that more of what people would get when they're using like a growth hormone, like hormone replacement fully, as opposed to, again, the peptide, which really
Yes.
works along with the pulsative effects of what the pituitary is actually putting out naturally, correct?
Yes, that is absolutely correct. You can imagine that if you inject it into your sort of abdominal area at 3 p.m., right? It's a huge bolus. It's just going to cause this surge. It's not going to have, if you look at the growth hormone levels, it's not going to be this nice curve at the right time. It's just going to be a bolus, or it's going to be just continuous overload. And that's going to have all sorts of downsides. You're going to get all these bad effects of growth hormone, nominal amount of its benefits. So it's really important that this natural pattern is followed for growth hormone purposes. Sermorelin is just very unique in being able to do that. There were other medications that in the past we were able to compound, like ipamorelin, desmorelin, and they don't have the same properties as Sermorelin does in having this nice episodic release of growth hormone. You don't have, if you have an excess release, the body responds differently. You have increased tachyphylaxis. You mess up feedback loops and so forth. Underappreciated is as you age, like everything becomes crummy, including your own pituitary gland. It will sort of, there is a concept called pituitary reserve, where it's the ability of your pituitary gland to respond to signals or to other agonists that are presented to it. And that just goes down with age. And Sermorelin, through a messenger RNA signaling system, preserves pituitary response. So you can see the benefits sort of like accumulating and adding up in a compounding fashion, where it's providing the growth hormone release in the ideal sort of phases in the episodic manner at the right time, but it's also improving the hypothalamus pituitary growth hormone axis, where the entire system becomes more robust with age. with increasing age, it's preserved. So that's another big advantage of Sermorelin. It's not just doing the growth hormone, it's making that entire axis like become a little stronger, more robust, more responsive.
Absolutely.
Uh,
And I was just going to interject. When I speak with a lot of clinics, or even when I was working in clinic, just the explanation for people a lot of times as practitioners explaining this to, a client or to a patient, when you're going through this, I would always talk about like an exogenous growth hormone, because you discuss this. So to simply kind of highlight everything, is that can actually desensitize those receptors. Again, in that bolus, it's a massive push. It's going to create that issue. Whereas the best analogy that I always give is utilizing something like Sermorelin is like utilizing reading glasses. So it's not going to harm anything, but it's going to enhance the focus of what's needing to be done. It's not taking away from what you have. It's just optimizing what's already there, knowing that, again, we have cellular exhaustion, which with that cellular exhaustion comes the exhaustion of signaling molecules like peptides or amino acids or whatever those may be. So then when we can use something like Sermorelin as a peptide to naturally allow that pulsative effect, hit that pituitary, give the release, and then that back regulation that's basically saying we have enough. So it's enhancing it, not overstimulating what typically an exogenous product would do, correct?
It is beautifully put, Dr. Adam. I can see you are an expert on this area. That's exactly what it does. It just preserves a lot of your feedback loops. It's not doing anything it's not supposed to do. We mentioned growth hormone like going down with age. But there's other things that are going on. If you have like excessive, say, visceral fat, right? There is a correlation with excessive visceral fat and reduced growth hormone. It probably has to do with when you're in a state of chronic overnutrition, this visceral fat is just putting out pro-inflammatory factors. It's putting out chronic IGF-1, hyperinsulinemia. And this seems to have feedback loops where your growth hormone actually goes down. So it's gone down substantially with age. If it's just all these metabolic factors like visceral fat, it further makes it go down. And you can see how this just works so well with a drug like a GLP-1 agonist. I sometimes think of a telescope where you can manipulate these lenses. And when they're just in the right place, you just see the beautiful Orion Nebula open up. You can manipulate the Sermorelin, the GLP-1, and they sort of like help each other out. They're sort of making up for the deficiencies of the other. And the outcome in the end is just really beautiful. It's just an excellent regulation of the body systems. So one of the big things about Sermorelin, even compared to ipamorelin or some of the other like growth hormone agonists out there, secretagogues out there, is the preservation of hormonal feedback loops. If you were to have like unrestrained growth hormone action, your body would be a wreck. And the body is just very smart like that. It has a lot of feedback loops that keeps things stable. There is another hormone called somatostatin, which is part of the hypopituitary and hypothalamus axis, which sort of will put the brakes on excessive growth hormone function and expression. Growth hormone will also sort of like get feedback from IGF-1. And IGF-1, as we will discuss, is just very critical to some of growth hormone's effects. This is just a diagram. You can see how many feedback loops are involved over here. A few of them would be the IGF-1. It's produced by the liver. And then IGF-1 would then have direct sort of negative feedback loops on the hypothalamus, on the pituitary gland, and a positive feedback loop on somatostatin. And that prevents growth hormone from just having the optimal effects that a body does need and does benefit from, without any of those negative things that you might get from just a bolus injection of direct growth hormone. There's a lot of detail over there, but you can see for the number of feedback loops that are involved, number of factors, this is a big advantage of Sermorelin. People are a little, skeptical when they hear about the word growth hormone, thinking it's going to turn them into a freak. With Sermorelin, what it's doing is maybe turning back the clock. It's the same you. It's the same you as you were, say, maybe 10 or 15 years ago. That's sort of probably the dictionary definition of what like an anti-aging med is supposed to do.
Mm-hmm. Well, it's a beautiful chart, and at least everybody's able to reference that and get back to that. And again, everybody gets a recording, so don't worry, you're not missing anything.
Yeah, so let's just discuss some of the benefits of the Sermorelin. Sermorelin's effects will come from growth hormone directly, but most of its benefits seem to come by inducing IGF-1, which is produced by the liver. It's almost all going to be beneficial effects. Some people think, well, how can Sermorelin be an anti-aging med? And then we have rapamycin. Rapamycin sort of like has a reverse effect on IGF-1. But the two scenarios are different. When you have too much of something, too much of insulin, too much of IGF-1, chronic overnutrition, you're going to have this sort of unbridled growth and proliferation processes. And those do have a downside. In this case, when a patient is on a GLP-1, they're in a state of bit of a nutritional restriction. And this is where like Sermorelin just works wonderfully with what GLP-1 is trying to do. On the chart there, we have some of the benefits of Sermorelin, but if you go from the bottom left clockwise, you're going to see some of its benefits manifest earlier. And as time builds up, these benefits just accumulate. One big thing would be its effect on a non-REM sleep. It works in perfect conjunction with a circadian rhythm. Like we mentioned, it is released during the first wave of slow wave sleep. But growth hormone will have a direct relationship to sleep too. Patients who have been sleep deprived deliberately by cruel scientists out there, they do have impaired growth hormone release also. So the cause and effect sometimes isn't clear, but it does lean that way. That if you don't have enough, if you don't have good sleep, it's going to impair your growth hormone, and it goes both ways in a bidirectional manner. So the growth hormone, when released, has this wonderful effect of surging through all the capillaries of your brain, and the epithelial lining of these blood vessels tends to get eroded over time. Growth hormone will tend to repair them. If you were to pair like poor sleep with maybe hypertension, it really is very detrimental to brain health. And it could be a reason why you have like neurodegenerative diseases. When they assess how much people sleep between the ages of maybe 40 to 60, those adults who have slept the least do tend to have some of the worst outcomes with these diseases, with cognition, with dementia, and so forth. And it's interesting how sleep tends to deteriorate with age. When we talked about like muscle mass, sarcopenia, muscle loss, it tends to accelerate very sharply after the age of 60 or 70. When it comes to sleep, most of the deterioration in one's sleep tends to take place from the ages 20 to around age 60. And it seems to correlate with the growth hormone. So with something like Sermorelin, if you're in your 30s, 40s, 50s, it really is definitely providing a very sort of neuroprotective benefit just right off the bat. It's going to improve cognition. It's been shown to have like better mental agility, better mental focus, mental clarity. And these tend to be more notable amongst the elderly population. Probably will benefit a 25-year-old too. But that growth hormone is especially very important as we're aging past the age of 40 onwards, going on 50, 60, and so forth. So that process that's taking place in your blood vessels, where the growth hormone goes in and just repairs these vessels, makes them healthier, it's probably taking place all over your body. It's used by growth hormone is known amongst athletes that it's quite important to like tissue repair and recovery. And usually like working out and recovery go hand in hand. Sermorelin is going to assist in those goals. Over time, maybe month 2, month 3, it's also going to be very beneficial for one's skin. It's going to sort of stimulate collagen production. Patients would notice like healthier skin, thicker hair, thicker nails, and so forth. And over time, growth hormone is also known for its effects on libido. I mean, you think of your typical GLP-1 agonist patient, they're taking it to become thinner. It makes them feel more attractive, makes them feel sexier. And there you go. Libido is something that's just what's called for over here. Over time, you will begin to see also like significant physical performance benefits, improvements in energy levels. It does this directly through mitochondrial function. It will improve something called mitochondrial biogenesis, which is just the creation of new mitochondria. This is when IGF-1, which has been synthesized by the liver in response to growth hormone, will act on growth hormone receptors to improve mitochondrial biogenesis. I mean, for the athletes amongst you who have tried to improve your VO2 max, you know that this is a very important process, and it's quite challenging to sort of get it going. And it's just goes down to the root of energy production. But in addition to just newer, healthier mitochondria, it is improving ATP synthesis and ATP utilization. So you will begin to see energy benefits, fairly early on, but as time goes on, these would just accumulate with just better mitochondria being produced by your body. So it does provide more durable benefits. Over time, Sermorelin is going to have the effect of decreasing your fat mass, especially some of that bad visceral fat mass, which tends to be very pro-inflammatory. We also recommend Sermorelin with patients on testosterone replacement therapy for this reason, because sometimes patients just respond well, with testosterone replacement. You'll see, okay, they're packing on muscle, but it's still a little bit challenging to get rid of that extra fat. And Sermorelin just provides the push.
Sorry, I've got a question for you real quick. I mean, obviously there's tremendous, in a sense, anti-aging effects, ATP production, insulin sensitivity. How long does it typically take somebody to start to begin to see results once they start taking Sermorelin? I've in research, it talks, cycling, 5 days on, 2 days off. I've heard 6 days on, 1 day off. Are there also cycles that people should go on, like 3 months and then take a month off? What are the typical recommendations on that? So a couple questions in there. How long does it typically take to begin to see results from this? And then how does the cycle work? And I guess we could add in there a third question. Sorry, I'm throwing them all out you. Typical dosing. What does that look like?
Yeah. And you beat me to it, because that's the very next thing we were going to discuss. But you can see that the benefits will accumulate. They will accumulate from the day you start taking them. You're going to see more mental clarity. You will see improved sleep. If it says anything, I take Sermorelin myself. Improved sleep is something that I notice right away. You have to commit to a healthy sleep regimen too, because you're going to get benefits out of the Sermorelin. So those will be the first ones. You're going to see improved skin, improved collagen production by month 2, month 3. The energy benefits just tend to accumulate because it's hitting so many different systems. But things like body composition can be very it can be a challenging needle to move. It's not going to happen in week 1, week 2. You got to stick with it, and you've got to do everything else correct. I mean, you could take all the Sermorelin, if you don't have good sleep hygiene, if you're not working out, if you're not doing resistance training, then those benefits are going to be highly limited. So you could wait up to 6 months and the benefits will just keep on accumulating. And, by month 6 is when you could actually see, like, maybe you can see you can become a little bit more buff, you have more muscle. And it just accelerates from there. Once you have more muscle, the muscle becomes a sink for your glucose and your calories. It helps you retain that body composition. But body composition is just a tough one, especially if you are not in a caloric surplus. It can be a tough needle to move. And Sermorelin just then becomes that much more important to have on board to be able to get those sort of like goals in body composition.
Absolutely. I know we're going to be going on to the dosing, but I wanted to stop here real quick, Shalin, and I want to discuss, I know from the very beginning we were talking about the GLP-1 event where we're going to be talking about stuff just like this, nutrition, adding in those verticals. So I would love to share real quick with everybody, because I know that we're getting close on time, and I want to share with you guys what this GLP-1 event really is. And so when we are, hang on, and when we start getting into the trainings that we bring in and helping people understand, really meeting people in person, like Shalin, like Rhonda, like Lindsay, this GLP-1 event is one of those times where you get to literally rub shoulders. You get to ask every single question. The people that are on the stage actually come down, and we get a lot of one-on-one time. And so I wanted to share with you, because I know we're doing a broad scope of Sermorelin and GLP-1s, and I promise you we're getting to get back to that. But I wanted to share with everybody this real quick, because this is where the certification training comes in. How to build these verticals. What does the actual step-by-step process look like? What is the blueprint that you're actually going home with to be able to then implement things like Sermorelin, to implement the hair protocols, to implement red light, whatever it may be on those verticals? This is where you get to learn that from Lindsay, from Rhonda, from the Strive team. But this is our event coming up. It's at the Wigwam Resort, Phoenix, Arizona, April 18th and 19th. Again, this is where, well, we've hosted many of these trainings. Sometimes it feels like a fire hose of information, but that's okay, because we have a couple days to be able to share with you what we have. Compliance. Where is the industry going? How do you make sure that you are ahead of the game, not being left behind when it comes to GLP-1s, implementing them within your practice, and then staying around? It doesn't matter if you're in an area, we hear this all the time, well, I'm in a small town or I'm in a big city. The people who are in the small town and in the big city both complain about the same things. It's either oversaturated, or everybody is already here doing it, or nobody is around and everybody is going everywhere else. That to me is just an excuse, because everybody can be successful at this. I mean, I was a chiropractor by trade, and I'll tell you, there were 20 chiropractors within a 5-mile radius of me. I still grew a practice to over 450 patients a week. So what we do is help you to kind of really siphon through all the pitfalls that people are dealing with in this industry today, so you can go and truly take over your market and do it the right way. This is our site. These are our speakers. We're extremely excited to have you come to this event. We're adding more speakers every single week. If you have questions about the event, at the very bottom, man, there's a long page here. We have FAQs clear at the bottom on all the frequently asked questions. But what I want to do is to give you guys what the special is for this event today. We are offering for you, it's 25% off our current pricing, which is actually early bird, 50% off the original price. So you can see one ticket currently right now is $997. You will get an additional 25% off of that price utilizing Last Chance 25. And why is it the last chance? Because this Friday, all of our ticket prices are going back up to their original price. So all of these prices will double coming this Friday. So the $997 is going to double. The $1747 is going to double. So there is a tremendous amount of savings. This Last Chance coupon that you will put in right here and apply it to your ticket price is good until 11:59 tonight. See, Christy, I didn't forget to say that, till 11:59 tonight. And then this Friday at 11:59, all these prices are going to double. You'll only be able to use discount codes if there are any out there. But again, make sure you get that. This is not just for clinicians or physicians, whether it's an MD, DO, nurses, nurse practitioners, physician assistants, DCs. This is for clinics. We have the business side, the front office, back office that are all coming to these events because we're not just teaching about the clinical application. We're teaching about the business and the clinical application so that you can have a full plate of information, again, to take home and implement and move forward. Christy has actually put the information in the chat over on the side. So please do not forget to look over in the chat. It's probably way up high again because people keep asking. All the certifications, yes, do come with the live stream as well. And again, this is not, and I'll just preface so everybody knows, this is not CMEs. We're not giving CMEs, but it is a certification which has helped over the years with the trainings that we've done, even on insurance, just to show that you advanced training in a specific industry and a specific therapy is huge. And even letting your patients or your clients know that you've done this actually sets you aside from the clinic down the road. Because some people are just implementing these things. They're just implementing Sermorelin. They're just implementing GLP-1s, and they have no actual training on how to do so. So we want to be able to be that source for you, again, so that you can take that home. The reason why this is the last chance and the prices are going up, just in all transparency, is because we're almost full. We have room for 100 participants. We're at, I believe we're at 67. So the prices are actually going up because we don't want people to buy tickets. Wait, no, scratch that. We do want people to buy tickets.
Well, also a lot of people purchase more than one because usually when a clinic comes, they want to bring additional people. So I have been saying I probably have room for about 10 more clinics to attend,
Yeah.
and then we're capping it out. It's
Yeah.
only going to be small. There'll probably be 40 to 60 clinics in attendance to foster a lot of communication and community and all of that.
Yeah, and the reason, that's the reason why we keep it small is because we want you to be interactive with our presenters, with our speakers when you're coming there. We will be going through the standard GLP-1 dosing. We'll even go through microdosing. We're going to talk about, I mean, that's the beautiful thing about what Rhonda and Lindsay have created in their company. In fact, even just on marketing, okay, listen closely. On marketing alone, they didn't even mention the names, things like semaglutide, tirzepatide, and they were able to build $1 million practice without using that in their marketing. So if you want to learn those things, learn those tips, those trades, get the blueprint, that is what this event is for. So if that's what you don't want, then that's okay. Then don't show up. That's fine. But if you do want that, that's what we're here for. So I just wanted to share that before I know time was getting close. Everybody is busy, and I totally get that. And I also want to respect time, but I wanted to share that with everybody. Again, the pricing. So we have last chance 25. It's a 25% reduction in the current price, which is already at 50% due to early birds. That is going to go away, that last chance 25, tonight at 11:59. And then this Friday, the early bird pricing, which is 50% off the regular pricing, is going away this Friday. So this is your last chance to get the best pricing that we are offering for our GLP-1 event. So I'm making sure that you all know that. With that being said, I'm going to step back. We have a lot of questions, and we have like 4 minutes, Shalin, left in our
I want to wrap it up, but we are close to the end of where we need to be. But, you know, look at that slide. I mean,
go ahead and share that slide.
Sleep benefits, you have cognitive benefits, improved vitality, improved energy, improved libido, improved insulin sensitivity. What's the bucket word that comes to you for all this? It's youth, it's youthfulness. And that's where, that's where the benefits of Sermorelin sort of stem from and work so well with the GLP-1s. But Dr. Adam, to get to how it should be used, you are correct that it should be cycled. Get to that. Yeah, it should be cycled. What we do recommend is to take it 5 days a week. We do have an injection form. We have a troche form, and we have a nasal spray form. It should ideally be taken on an empty stomach. And the reason for that is food can interfere with, food will increase glucagon and insulin levels, and it'll make them sort of like fluctuate. And these will have a bearing on, somatostatin levels. So somatostatin will act on the insulin and the glucagon, and this can interfere with how well Sermorelin works. So always take it at bedtime on an empty stomach. The medication, regardless of the form, is kept refrigerated. There isn't enough study in how it fares in pregnancy. We do recommend to avoid it. Likewise, because anything that has a growth stimulating effect, it should be avoided with in anyone with an active cancer or tumor. In addition to the 5 days on, 2 days off, like Dr. Adam mentioned, some of our providers will have a patient on the medication for 3 months and then take 1 to 2 weeks off. And it just helps to reset the system so the receptors don't get desensitized. It helps the effects of somatostatin to be sort of tamed a little bit, reversally. Sermorelin just does its best. It should be used ideally with omega-3 and creatine. Both of these medications have been well studied, and they will reduce muscle mass, especially sarcopenia in older adults. So it works hand in hand with Sermorelin. And these two they're some of the most well-researched supplements out there. They just have a ton of other benefits in cognition, depression, health, and that goes for both creatine. It also goes for omega-3 fatty acids. Resistance training is a
we have 1 minute. I have to get this in because we have some people that are asking. It's like
sure
overload right now. This is the fire hose coming in. We may have to host another.
Absolutely, yep.
We may, but so with this dosing, is it let's do quick. I mean, we talked about frequency, but is it typically 500 micrograms? Is it 1 milligram? Is it 2 milligrams? But I think most importantly, I think one of the, I say one or multiple questions are, what are we looking at for contraindications? If there's a patient that say has cancer, is this something that should not be used? Obviously due to the growth hormone side of things. Is it, if they have a history of cancer, if they've been cancer-free or released from their treatment for a year, is it okay to then utilize something like this? What are your recommendations there?
We just say avoid it in active cancer. We would leave it up to the provider's discretion on the other things. Just keep in mind everything we discussed about Sermorelin and its advantage over just exogenous growth hormone. You see, cancers tend to show up more like in elderly people, right? But younger people have more growth hormone, and Sermorelin doesn't cause these supraphysiological effects on growth hormone. I would think it's going to be safe if a person is completely recovered from cancer. It might even help because it's helping sleep. When you have better sleep, your immune system functions better. It's taking out those latent cancer cells and so forth. I would, out of caution, just avoid it in just anyone with an active cancer. There are just very few like contraindications to this, maybe hypersensitivity to an ingredient. And active cancer is one, avoiding pregnancy.
Wonderful. All right, let's do this. We have, I mean, we still have a lot of people that are staying on. So, I mean, I have time. So I'm going to stay on because I want to keep going through some of these questions.
Really?
As long as everybody else is good, I will stay on. Christy, I know that you have to go because you have another meeting.
I'm emailing to push that out, so I try to stay on a little bit longer.
Okay,
so
wonderful.
I know we've got a ton of questions, so I figured I don't want to leave you guys hanging. And also, we can send out notification and maybe try to find another Q&A opportunity for a webinar, sort of maybe a combined Q&A from all of the webinars we've done with Strive thus far, because it's great engagement. You guys have excellent questions. So maybe we can do another kind of, we'll add that to the calendar. But obviously at the event is where we will really do a personalized deep dive and get all of the very thorough, detailed questions done at the GLP-1 Summit. So
yeah. And Shalin, you've done an incredible job. I just want to say thank you from our team for the information that you've given. I mean, you know this inside and out, and it's been an honor to have you sharing this with us today. I know that I've learned more. I always feel, you know, because I do get providers a lot, and I mentioned this in our webinars, that like, they're like, well, what else am I going to learn if I come to one of your seminars? And I'm saying, well, if you could learn one thing that could transform the life of a patient, help them get better results, then it should be worth coming to learn that one thing, because that's ultimately what we're doing as providers and practitioners is to find that one more thing. Nobody ever knows all things. And plus science is constantly changing, and we're learning new ways to implement these things, especially in this GLP-1 world that we're in. And again, Sermorelin can be utilized by itself without GLP-1s and has incredible efficacious results to help people with weight loss, or I should say, I like to say fat loss, with muscle gain, and again, better sleep. It's a beautiful thing. So with that being said, I know we're going to put the links, put the code in there, Christy, for them. Could you tell me, though, one of the questions that I saw was, is there a benefit from nasal to troche to sub-Q? Why the different options? Is it more so people are scared of nails, or needles, and then people are scared of putting troches in so then they can do nasal? Is there an added benefit to one or the other?
The most effective one, of course, is it's going to be the sub-Q injection, but not everyone likes needles. And even if they don't care too much for needles, you have to do it five days out of 7, and that might not work very well with everyone. It can sometimes cause a bit of burning. It's minor, but it can be objectionable for those patients. You have either the nasal form available or the troche available. The troche is going to be a little less bioavailable, but we do show that it does work. We have it in a 600 microgram troche. You could custom do it for 1000 microgram troche, and it also does work. But obviously, the injection is the way to go for just the best benefits.
Yeah. With patients that are typically complaining of like itchiness at the site of injection, I know that with sub-Q, there's multiple spots. I mean, you can go back behind the tricep, you can go, the umbilical region about 2 inches out from the umbilicus. I know upper thigh. Is it most important that you're just getting it into that subcutaneous tissue? Does it really matter where?
It doesn't really matter. And even regardless of how much weight a person has, the skin's thickness is going to be 2 millimeters in most areas. We just recommend just doing it in the belly area, just for dexterity reasons. It's just easier to administer it away from the belly button. It's just a lot of nerves and blood vessels there. Just a little bit to the side, and the belly button is just the best place. But if you find that someone else is administering it for you and they want to do it in the thigh, that will work just as well.
Wonderful. And then with that, then the itchiness. I mean, I'm assuming that your product, it already comes in the liquid form for the sub-Q. Is it in like a bacteriostatic water? I've heard a lot, just that backwater. Obviously, there's a little bit of alcohol, which can create some irritation, and everybody's a little bit more sensitive or less, depending. Would you say that's probably what's accounting for that?
The amount of benzyl alcohol that's going to be in our products is minimal. Frankly, just patients truly reacting to that, very far and few in between. But these medications inherently do have a pH. If the pH is on the low side, that can cause a burning. Sometimes, you just accidentally nick a small nerve or something, and that will cause prolonged burning.
One thing I see sorry, Dr. Shah, I see with injectables, and clients are a little bit hesitant with the needle, and they don't go under the skin, they just inject into the skin. And so then in creating more like a wheel or a hive. So really be sure that they're using a long enough needle and they're getting it under the skin and not into the skin. I see that a lot with the GLP-1s.
An excellent tip. Yes.
Like a 5/8 inch needle. I know there's millimeters and there's 5/8, nothing
Yeah.
smaller. And I would
The
assume
5/8 is best. I would stay away from the 1/2 inch. I find that those are the ones we usually have the problem with.
Yeah. Perfect. Questions. I know we have more questions. All of a sudden it's silent.
I know.
Good question.
Lunch is over.
Yeah, I know everybody's.
We had some questions on stacking, and recommendations there that looked very interesting. If you're stacking GLP-1s with like LDN or NAD, sort of what would be optimal there, and dosing kind of suggestions, perhaps.
Yeah, we recommend that. especially with LDN. LDN just tends to get underutilized. Patients will sometimes report that maybe they've plateaued early. Of course, they have to be counseled well, just make sure you're preserving your muscle mass and so forth. But then LDN will be the next best thing to sort of add on that to sort of get past the plateau. It's not going to really have a conflict with each other, and they would be an optimal choice for a lot of patients, just looking to get the maximum benefit. With Sermorelin and GLP-1, I mean, it is just perfect. They beautifully interdigitate with each other by making, by sort of like accounting for each other's deficiencies. And in combination, it's just like a very beautiful combination that will work for a lot of patients. You can imagine patients just taking a handful of these medications. I'm not of the favor where people just keep on adding more and more drugs to the regimen, but you have a handful, select ones. You have a GLP-1, right? You have Sermorelin. You can add LDN to that because it has a lot of other benefits, like in autoimmune disorders and inflammation and so forth. Just think about it, that how much you've helped the patient. They're going to feel energized. They're going to have a sense of vitality. They're going to feel good about themselves. They're going to look good. It's going to help numerous disease conditions, from cardiovascular disease to diabetes. But just think about how many meds they're not taking. You open that medicine cabinet. I mean, you have really touched their lives. You've really impacted them in a positive way. So yeah, with just careful selection, these medications can be very beneficial. You'll end up actually taking less of a load. You will end up, with your overall health down the line.
And Shalin, there's a few people that were asking about exact dosing. I remember as thinking back on your slide, so it's 1 milligram per ml in the dosage, and you were recommending 0.15 to 0.3, which that equates to what, 150 micrograms to 300 micrograms per dose.
That is correct.
Yep, and it's getting put in there as well. But
yeah, it is on the slides. We do have recommended dosing. We don't see the nasal spray being prescribed that much, but it'll work just as well. So with an insulin syringe, that would come to 15 to 30 units each night, 5 days a week. And the troches generally will be 600 mcg, just placed in between the gum and the cheek. And it takes about 20 minutes to dissolve. That's done at night. Just make sure you're not eating anything. It's fairly simple, straightforward.
So I get a lot of questions on, well, I thought peptides like Sermorelin were supposed to be dosed off of kilograms or body weight, pounds, weight, based on the individual. In my recommendations, I've always gone more so with where you're at. You have a range. I'm a less is more person. So starting low and you can build up. Do you ever then see that you go above 300 micrograms? Or would there ever be a reason for that?
I would not think so. I mean, it's a growth hormone releasing hormone. It doesn't take much to get proper stimulation. This is not like sort of an inorganic molecule like metformin. You got to build up the dose all the way to 2 grams a day. It just takes the correct amount, and irrespective of body size, I think so our dosing recommendations are going to work for the vast majority of people.
And is it different for males or females typically then?
No, it's going to be the same. They will gain this is a very small amount getting into the body, and it's just the correct amount needed for your body to do what it needs to do.
And again, this is different, just to create clarification, because these are some of the questions that are coming in. A peptide like Sermorelin is not the same as an exogenous growth hormone, where you do need to be much more specific on what you're doing, because you would give a woman a different amount than a man. And same with like HRT. If it's testosterone, you're not going to give the same amount. But because of its effect, like again, the reading glasses analogy, we're creating optimization. It's not that I would say it's not pushing it and telling it necessarily what to do. It's optimizing its natural effect.
You nailed it. Yes, that is absolutely correct. And we discussed it in the slides that the Sermorelin is just going to make your own body secrete just the right amounts at the right time. So if you were to do like an omnitrope or an actual growth hormone injection into yourself, it's very difficult for a doctor to assess what is the correct amount, how much is getting pushed into the body and so forth. And they present challenges to therapy. With Sermorelin, it's much simpler, it's much more elegant, and your body will do it for you.
I love that. I mean, I love the fact that you're saying it's the elegance of what a peptide can do.
Yep.
Is not
Nice.
pushing, it's enhancing the effectiveness. Really, it's optimizing and building. So that's why I love peptides so much. They're amazing. And for those of you, yeah, I know, run
With you on that one.
but just the fact a lot of practitioners don't realize GLP-1s, what are they, people? They are also peptides. They're peptides. And that is another thing that I think, just to create clarification for those that are still on here, which is incredible, because there are a lot of people that are still on here. I think they're skipping their patients right now just to stay and listen. Good for you. Patients may be unhappy, but that's okay. You're just telling them, I'm learning how to make you better, to optimize your life, right? Is that in combination, and I think this is a key thing to help people understand when it comes to peptides, like a GLP-1, like Sermorelin. And I've got people that are asking about BPC 157, and some other things. They all work on different receptors. So even though there's some pleiotropic effects that happen in the downregulation, it's not like they're going to clash with each other. In fact, most of the time, they actually enhance the effectiveness of each other, like a BPC, which does help with endothelial nitric oxide. We talked about Sermorelin, repairing that endothelial lining. So in combination, there can be some beautiful effects that are actually happening for people.
Absolutely correct. I could not have said that better yet.
Where else? Oh, and just so that everybody knows, this is not recorded. We teased you. No, just kidding. It is all recorded. I promise you. Don't worry. And
Walking off now.
It will hate me. The amount of mad emails. Do not do that. I already made promises.
is it Katie? Katie, thank you so much. This actually has been a really, really fun webinar. We could probably do this for 3 hours. Quite honestly, I can tell you that I could. The recording will be emailed to you. So again, do not worry. The recording will be emailed. I know that people need to get going. We have definitely gone. We're 15 minutes past our time. One last time, we really hope that we get to see you at our GLP-1 Summit, along with Strive, MedBio Institute, bringing you this education. It is recorded, so do not worry. It will be emailed. Just give us time. There is an FAQ section on our landing page, glp1summit.com. And we're going to put in here the code last chance. Remember, last chance, 25% off the already early bird 50% off ticket prices right now. That pricing is going to go away. The 25% reduction in ticket price that goes on top of that 50%. Yeah, I know, lots of numbers here. Ends tonight at 11:59. But what really ends, the last chance that you have, is the full 50% discount this Friday. So tickets are going to double in price across the board. So please, we look forward to seeing you there in person, having fun, and answering even more questions just like this. And so thank you so much. Yes, last chance 25. Alicia, it is there. So in fact, right above what you just asked. So thank you so much. I'm going to stay on for just a couple more minutes because I don't want to just close it off right now. I'll just let you know, there are a lot of people and practitioners that are seeking this. And I know this because the number of people trying to attend these webinars. I mean, we had over 1,000 registrants on this alone, 1,000 from last week. So thank you as the attendees and people that have actually shown up to take this knowledge in. I can't say thank you enough, because we know that you are going to be the ones that are going to transform this industry and to change people's lives. And that's really why we do this. So there's a few hands that are going up. I'll just answer a few questions if we can. I think it's Christine. The hands just keep going up, but will the summit go over all peptide therapies we use with or without the GLP-1 therapies? Yeah, we are going to be speaking on other peptides as well. So you can definitely come and learn about those. And that's for Yvonne, who is asking that. I think that understanding things like Sermorelin and even BPC and the applications of how these work is essential, and it's how they work together. And so we'll definitely be going through that. I'll just go with this last one. The efficiency of spray versus an injectable. Well, we already discussed this actually. The injectable, the sub-Q, is going to be the most. I'll even just say the word potent. It's going to give you the greatest result. There's a reason why if we look at an injectable and it's 150 micrograms to 300 micrograms, and then a troche is at 600 micrograms, it's probably because we're not going to be getting as much of the absorption. So we're giving a little bit more to get into the system. So, and does Strive offer BPC? That's a question that I can't answer, but Shalin, you can. I believe you guys have an oral pill form, correct?
You know, we're having some changes to our business structure. BPC 157 at this very instant, at this very moment, isn't available, but we do anticipate that it should be available in our OTC storefront within a few months or so.
Wonderful. Fantastic. All right. Well, this is going to be our last goodbye. I think I've said goodbye 4 times this webinar. But I've got kids that I've got to go pick up. I know, Chrissy, you pushed your meeting back. Rhonda and Lindsay, thank you for both attending and taking time out of your day for everybody here. By the way, next week we do not have a webinar. Is that correct? No webinar
Correct.
next
It's in 2 weeks.
Oh,
And I know a lot of people have a lot of questions for Shalin as well. So hop
Yeah.
on the webinar. We will still be.
And- Yes, and Shalin, you left your email. I don't think you know what you did, by the way. He put his email. Can we put his email in here real quick for everybody?
Yes.
Last
Quick,
time.
to reach us, because there's about 1,000 people on this
Okay.
webinar, so that you can email training@medbioinstitute.com. I put that here. If you want to reach somebody at Strive, Shalin or someone there. Maybe, is Andrea still on? No, she maybe is not.
I'm actually right here.
Oh, there she is.
Perfect. There, you're there. Hi. You want to maybe drop an email that's good in the chat for people at Strive that want to reach Shalin or any of you guys on the team there at Strive.
Absolutely, I can do that if I can find my
Thank
cursor.
you.
Yes, we'll take care of that. I'll put that in now. Is it clinical? Let's try.
So if it's about the summit or the event or training stuff, you can email us at MedBio Institute. If it's pharmacy product specific protocols, head over to Strive.
Head over to Strive. So
Yeah.
thank you all so much. We appreciate you all. Again, Rhonda, everybody, you're all amazing. Thank you.
Have a great one, guys.
Thank
See
you,
you
Sean.
on the side.
Thank you. Bye.
Bye.